Hello, I'm Dr. Thomas Jackson, a prosthodontist and board-certified periodontist. Over years of practice, I've watched my patients struggle to floss connected dental appliances, such as implant bridges, braces, and bonded retainers. Current solutions like water flossers and floss threaders have limitations and often don't work. It's why I developed the AutoFlosser. It's a revolution in oral hygiene technology, designed for anyone who literally can't floss. The AutoFlosser system has two components: the handle and the floss. Feed the stiff end of the floss into the handle, point its tip at the area to be flossed, and insert the floss via a simple turn of the wheel. Flossing the most challenging areas becomes a breeze. My patients love the AutoFlosser, and I know you will too. Join me in becoming an AutoFlosser ambassador. As an ambassador, you'll feel great saving smiles while earning rewards. You can explore this opportunity by clicking the Ambassador tab at theautoflosser.com. Thanks, everyone, and here's to easy flossing. Thomas Jackson, and I invented the AutoFlosser. First off, I just want to thank Elijah. I want to thank the team at Smiles at Sea. You've been hospitable. It's been great. I can't wait till October to do it again. And I learned my lesson. I also want to thank the judges at home. We don't want to forget about them. Thank you. I'm going to make myself vulnerable here for 1 minute. And this is the truth. I came ill-prepared for this presentation. I had no idea that as part of the vendorship package, I could potentially be up here to speak to you for 10 minutes. And this is true. Yesterday, needless to say, I had a certain amount of anxiety. What am I going to talk about that I haven't already talked about for 10 minutes? That's a long time up on stage. So my vendor neighbor, Deneen, she said, why don't you talk about statistics? You're a periodontist. Give us some stats. That's probably going to fill up a good portion of your 10 minutes. Okay. Check out this stat. 100% of people that don't floss or brush are going to develop plaque. And plaque causes dental infection. Yeah? Plaque causes dental infection. I told you it wasn't going to take 10 minutes. So I met a lot of great friends here. One of my other vendor friends said, you know what? It's simple. Just tell them your story. Just tell them the story of the AutoFlosser. So here's my story. I graduated from the top of my kindergarten class in 1975. Yep. Fast forward, 1994, I graduated dental school. I went to Northwestern. From there went on and I did a 2-year general practice hospital residency in Baltimore at Johns Hopkins. I stayed for a year, collected my first paycheck as a dentist, and then decided to reverse everything and go back into student loan debt. I went to Penn. I did a 4-year perio and prosthetic residency, and fast forward to 2021. Now, I've been in clinical practice for 20 years, and what I've found in my area, in my practice, is that all-on-4 implant prosthetics are becoming very common. They're becoming common because patients love them. It provides them with teeth that are fixed in place. They cannot come out at a reasonable price point compared to some of the alternatives that we were doing years ago. As a restorative dentist, it is a great day to be able to put in one of these prosthetics into our patient's mouth. We know they're going to smile. We know that they're going to eat. Patients are overjoyed on that day. They've spent months healing. They spent many appointments with impression taking and try-ins. This is the day that they're liberated. They're going to get their teeth. Well, as a disruptor, at the very end of that appointment, I have to break them some bad news. Mrs. Jones, now that you just got this great appliance that's not going to come in and out, you got to keep it clean. All right, Doc, well, how am I going to do that? Well, you're going to take this floss threader. It's a little blue monofilament plastic tip that has a loop to it. You're going to take a piece of floss, you're going to put it in that loop, You're going to take it to your bathroom. You're going to go in the mirror, look around the splatter. You're going to lift your lip in reverse, in the dark, and get that little tip all the way to the back of that bridge. And once you're there, you're going to stick it through. And then you're going to floss. All right. Well, being thorough, I want to make sure that Mrs. Jones knows exactly what I'm talking about. Stacy, my assistant, would you hand Mrs. Jones that hand mirror so that she can see exactly what I'm doing? Then Stacy retracts her lips, and I got my magnified glasses so that I can see things 5.5 times their real life size. With my LED light that's got casting a beam like Batman down onto her tooth. And I sit there, and I try to get that little tip right into that space. And I struggle. I got this. Stacy, hand me the tweezers. Now I grab that tip with the tweezers, and I get it through. Mrs. Jones, that's what you got to do. But I know in my heart of hearts, that there's no way she's going to do that at home. There's no way. So what do I tell her to do? And this is what we do as dentists when we know somebody's not going to be able to floss at home. Just get a water irrigator. It'll be fine. But I know in my heart of hearts that that water irrigator isn't going to get off that plaque that causes infection. That was the day the AutoFlosser was born. That's the day that I said there's got to be something better. So the AutoFlosser is a 2-component system. The handle and the floss. It is a handheld device that allows easy and simple flossing under connected dental appliances such as implants, bridges, braces, and bonded retainers. It's simple. You take the floss, you insert it into the handle, you take the tip of the AutoFlosser, you point it at any space you want to floss, and with a simple turn of the wheel, the floss comes through the other side, you grab it, and you floss. It truly is that easy. So the AutoFlosser is being marketed through an ambassador model, a professional ambassador model, and I'm hoping that my professional colleagues and the dental office team members recognize the value and that they want to recommend it to their patients. And when they do, the patient's going to receive a discount, and that ambassador is going to receive a commission. In addition, I'm asking my ambassadors, if they love it, to invite other ambassadors so that they can receive commissions on their sales as well. So that's my story. That's the AutoFlosser. I appreciate your attention at home. Check me out at theautoflosser.com. Have a great day, and thank you.